Good morning, all. Today, our topic of discussion is multiple sclerosis. So, before going to know about the multiple sclerosis, first of all, what do you mean by multiple sclerosis? So, it is an inflammatory reaction of the white matter of the brain and spinal cord, in which there is demyelination and followed by the remyelination, which appears as a scar tissue, and on radiologically it appears as a sclerosing bodies. So, that's why it is called as a multiple sclerosis. Primarily, it comes under classification of the upper motor neuron lesion, where there is destruction of the myelin sheath of the white matter of the brain and spinal cord will take place. Next. So this is most commonly seen in young adult women, especially 20 to 40 years of the age, and there is strong family history of other autoimmune diseases are there, and it may be triggered by the so many viruses, and the most important virus is the Epstein-Barr virus. Next, what is the pathophysiology? Simple. So it is an autoimmune or inflammatory or post-infectious immunological, both B cell mediated as well as T cell mediated destruction of the white matter, which means so there is a myelination of the axons will be affected. So in case if the disease was advanced, sometimes the axons may also be affected. So primarily it is a demyelinating diseases of the white matter of the brain and spinal cord on multiple areas. That's what is called as a multiple sclerosis. Next, what is the pathophysiology? So when the both B cell as well as the T cell mediated inflammatory markers will attack the myelin sheath of the axons, so there is functional impairment of the conduction will take place. So initially, so there may be accumulation of the so many inflammatory mediators as well as inflammatory cascade pathways will occur, yes, which will be sometimes which will be spontaneous resolve will take place. So that's why sometimes the symptoms may appear rapidly and disappear rapidly, or sometimes so when the functional impairment was advanced, which means so when the conduction block is there, automatically so depend upon the conduction block, so there may be motor symptoms, there may be sensor symptoms, so there may be autonomic symptoms will be present. Next, so when the conduction block is occurred or there is functional impairment of conduction will take place, so this will be triggered by the increased temperature of the body. So when the increased temperature of the body will take place, automatically so the symptoms will be aggravated. It is called as Utaf phenomena. And sometimes so mechanical stimulation on demyelinating fibers will appear, so automatically the symptoms may also appear, which means so the best example is the Lehermatis sign. So it is nothing but so on flexion of the neck, so there is electric shock like pain along the spinal cord, which means so when this mechanical stimulation is present, yes, which will trigger the impulse conduction along the axonal pathways because of a demyelination in nature. So there is abnormal conduction of the impulse will takes place, yes, which will trigger the symptoms. Next, yes, so the symptoms may appear. So the symptoms may appear as motor system and sensory system and higher cognitive functions as well as autonomic functions. So motor functions. So it may appear as a limb weakness, or sometimes so there may be paralytic weakness, or sometimes scanning which will present, or sometimes there may be spastic muscles will take place. Next, so sensory symptom, especially the sensory symptoms, especially the optic neuritis is the most commonest presentation of the multiple sclerosis, where this periventricular region was affected. So optic neuritis, so optic nerve was affected. So there may be eyeball pain is there. So there may be visual blindness will be there, or sometimes the diplopia will be seen, or sometimes there may be blurred vision will be seen. Okay. So along with optic neuritis, other sensory symptoms like pins and needle sensation and tingling and numbness sensation as well as other sensory symptoms will also appear. Next, so autonomic symptoms. So the autonomic symptoms mainly in the form of bladder and bowel dysfunction will take place, and higher cognitive function or higher mental functions like emotional impairment as well as the depressions will also be seen. and the most important thing is Charcot-Striate. So Charcot-Striate, it is nothing but intentional tremors and scanning speech and nystagmus. So these three comes under the Charcot-Striate of multiple sclerosis. Features of the Charcot-Striate. Charcot-Striate is also seen in cholecystitis, where this pain, jaundice, and rigor will be seen. But this is the multiple sclerosis related to the Charcot-Striate. Next, so what are the investigations? What are the investigations? So there is no perfect diagnostic tool for multiple sclerosis. So on examination of the CSF, so there is increased protein content, increased WBC because of the inflammatory nature. Automatically increased protein content will be seen, as well as increased the WBC content will be seen. Among the protein content of the CSF, so the globulin fraction will be higher. So oligoclonal blanks of the IgG will be higher in multiple sclerosis. Next, is what are the types of multiple sclerosis, or what are variants of the multiple sclerosis? So that is very, very important. So the first most important is relapsing and remitting. Relapsing and remitting nature. So this is the commonest form, relapsing and remitting nature. Okay. Next, and the second one is the primary progressive. And primary progressive. And third one is the secondary progressive. And the fourth one is progressive relapsing. So these are the four variants will be seen. So the most commonest is the relapsing and remitting in nature. So what are the important points in the multiple sclerosis are, first of all, it is a post-inflammatory reaction or post-infectious reaction or autoimmune disease of the white matter of the brain and the spinal cord. So it is the UMN lesion where the GBS will also shows the demyelination lesion, but it is the peripheral nervous system. So it comes under the lower motor neuron type lesion. Simple. Okay. Multiple sclerosis is the upper motor neuron lesion, okay, and GBS is the lower motor neuron lesion. Lower motor neuron lesion. Next, this is most common in the young adult stage. Plus, relapsing and remitting pattern will be seen. Okay. Plus, and both phenomena and increase the body temperature will trigger the impulse conduction. Next, Leher-Murti simple. On flexion of the neck, so there is burning pain along the spinal cord or electric shock like pain along the spine will take place. Next, so the commonest presentation in multiple sclerosis is the optic neuritis, where is the eyeball pain is there, diplopia, or sometimes double vision, or sometimes the blindness will also be seen. Next, on investigation, so oligoclonal IgG bonds will be present. And the commonest variant is the relapsing and the remitting type. So this is the important points on multiple sclerosis.